As the CDC continues to investigate the rare adverse effects from the Johnson & Johnson vaccine, word that more than 50% of all adults in the U.S. have now been vaccinated with at least one COVID vaccine. Now, that is good news, as the vaccination is now open to all adults that is, in the U.S., 16 ages and up. So joining me to weigh in on this and other issues is Dr. David Zeke with Northwestern Medicine. Good morning to you, Dr. Zeke. I want to start with a report.
Good morning.
I want to start with a report with Johnson & Johnson. It is still on pause, as we know, but the CDC now recommending that people who experience certain symptoms after getting it seek immediate medical treatment. Here's the symptoms. They include sudden severe headache, backache, new neurological symptoms, severe abdominal pain, shortness of breath, leg swelling, tiny red spots on the skin, and new or easy bruising. So explain these symptoms. Why are they of concern, and when would they likely show up? Would this be a week after, a few months after? Do we know?
We certainly do. So these are symptoms of that rare situation where platelets get activated inadvertently by the vaccine, and they then drop in number as they form clots in unusual areas of the body. That includes the brain, and that's why they talk about the severe headaches. That includes the abdomen, which can cause severe abdominal pain. It can occur in the legs with leg swelling, and that can cause blood clots to go to the lung, which causes shortness of breath. And the drop in platelets ends up causing little hemorrhages in the skin, which is the red dots they're talking about. This is extraordinarily rare. 1 in 1,100,000 people that get the vaccine will get this disorder, as far as we can tell. But it's important to seek any medical attention if you get this. It does usually occur between 1 and 2 weeks after. After 2 weeks, it is virtually unheard of at all.
Okay, that's reassuring to people who have already had it. So when do you foresee this coming back on the market? Some talk that could be possibly by the end of the week.
It's a good question, and we think that we're going to at least hear word by the end of the week of what they're planning. We hope that probably by the early part of May at the latest, we'll see this back online.
Okay. The CDC also showing data of anecdotal reports about some minor side effects after people getting the vaccine, and it shows that women and younger people have more side effects to Pfizer and Moderna. In fact, here's some of the statistics they are sharing. They say 78 reported adverse events occurred in women. 22% were for headaches, just over 16% for fatigue, the same number for dizziness. Those were the most frequently reported symptoms. So why is it that women and young adults are having more reactions to the second dose of these vaccines?
Though we probably don't know the entire picture, we feel a lot of it has to do with how robustly the immune system reacts to the vaccine, because the majority of side effects actually have to do with the immune system revving up in response to that foreign injection. We do know that young people tend to have a much more robust immune system than older people do. Women also seem to have a different immune reaction than men. We know that a lot of this is driven by hormonal issues and that X chromosome, but if you think about it, we know that men actually are at increased risk of having a severe infection to COVID and actually greater chance of complications. So it kind of stands to reason that the immune system of women is reacting differently to this vaccine somewhat, and in general, the more side effects you have actually is encouraging. That means that your body is responding more vigorously to the immunization.
Okay, now there's a lot of frustration with people who've been vaccinated. I really call this the elephant in the room here, because we're all told vaccines are the key to stop the spread. But then we're told once we get one and are fully vaccinated, we still have to wear a mask. We still have to social distance. It's almost as if the message has become muddled. Do you worry that this and the pause on J&J is giving more fuel to people who are against getting vaccinated? Because it's definitely something people are talking about.
Certainly the fact that we have a complication to the J&J vaccine does give fuel to the fire of whether or not this is safe. But again, it is overall a very safe vaccine, and this is a very rare complication. The fact that people are still wearing masks is simply because we do have some uncertainty out there as far as variations are concerned. We do know that people can still get the virus even if they're vaccinated, though it shouldn't be deadly. We are accomplishing everything we would like and actually are ahead of the game as far as the vaccine is concerned in efficacy and distribution. So things overall are looking very good. But yes, we've got some hiccups here. We just have to be patient and eventually we'll get to where we need to be.
I think patience has been the key word for the last year and we can't give up yet, right? Dr. David Zeke with Northwestern Medicine.
Right.
As always, thank you for your time. Have a great day.
My pleasure.